My name is Dr. Joseph C. Russell. Um, I'm a phlebotomist, which is a specialist in venous and lymphatic medicine. And I have been managing in varicose vein centers of Greater Cincinnati for over 10 years. We have been dealing with venous disease since 1999. I actually started the universal protocol to prevent deep vein thrombosis or clots as a medical director at Mercy Hospital back almost 10 years ago. This is now the standard of care in the United States. Dr. Mock, who is the head of vascular surgery at TriHealth, and his partner, Dr. Matt Recht, are skilled physicians who run a vascular teaching program and have been involved in the development of this technique in our office for some 10 years, as has Dr. Stuart Donovan, who's an extremely experienced general surgery, has done traditional varicose vein surgeries for many years, and now is very experienced and talented in performing this non-invasive alternative to what was a major surgery in the past. We see patients with all kinds of vein problems here, but most of them involve veins in the lower extremities because it's a very common problem, perhaps afflicting as many as 80 or 90 million patients in the United States. We also do a lot of diagnostic ultrasounds, which are professionally done by a physician, usually myself. And we do a lot of surface sclerotherapy for cosmetic purposes. So we treat the medical causes of skin problems, skin ulceration, and varicose veins, achy legs, but we also do a lot of cosmetic treatments on these veins as well, because people want nice looking legs in many instances. Sometimes this is the primary reason they are having it addressed. Varicose veins are a circulatory problem. The problem with varicose veins is that in most instances it's insufficiency of the valves of the greater saphenous or small saphenous veins. This leads to high blood pressure, not in the arteries, but in the veins of the legs. And this causes the development of varicose veins. And blood tends to pool in the lower legs and cause these symptoms of swelling, pain, discomfort, aching, tired legs. I think what makes us unique is that it's a one-visit center where you are seen, you are evaluated by the person who's actually likely to do your treatment, and there's no passage of information from one spot to the other with repeated visits. And there's never any communication problem as to what exactly is wrong with you and what the treatment provided is. The second thing that's unique about our treatment is that we can do most of these very comfortably under local anesthesia, so we do not require the presence of an anesthesiologist. We do not have to be done in a hospital, and this mitigates the cost significantly. Our normal cost for treating varicose veins in an average leg ranges from $2,000 to $2,500. Most insurance policies, or many of them, do not cover all the cost of these things, and many people these days have high deductibles or are not covered for varicose veins, and so I think we offer the most cost-effective solutions for those patients with high deductible policies or self-pay patients. It's still an affordable thing to do. There is no prep for this surgery. You can eat beforehand because we are simply using local anesthetic, just like you might get at the dentist. We have special techniques which make this very, very comfortable to do. In some patients, we use a little bit of sedation, but most do not require it. You can bring a family member with you or a friend, or you can drive yourself if you wish. This is done in a friendly atmosphere, but professional but friendly, and the procedure normally takes about 20 to 30 minutes. I'm Dr. Joe Russell from Varicose Vein Centers of Greater Cincinnati, and today we're going to do a laser ablation of Mr. Shelby's right greater saphenous vein, which is causing him pain in varicose veins. Mr. Shelby has not had any medications. We just do it all under local, so right after he's done, he can go out to lunch or do his normal activities if he wishes. So I'm going to go put a little tiny bit with a tiny needle of lidocaine in here and numb this up. I'm going to put a very tiny little nick in the skin. I'm going to put the laser catheter in eventually. And now we use ultrasound to determine exactly where that vein is, so that I put it in exactly the right vein. We're going to treat. Now we place this is not painful, as Mr. Shelby can tell you, is it?
Nope. Can't feel anything.
Numb this up nicely, so once these devices are inside the vein, which I'm in now, there is no pain associated with that. And this is an introducer catheter that gets into the vein that we're treating. This is the vein that's causing all the trouble. It's not the visible vein on the surface. This replaces the old surgery vein stripping. So it does not have to be done in the hospital. You do not have to have anything but a local anesthetic. No worse than a trip to the dentist, maybe better. That wire has been advanced all the way up to where that vein starts in the leg. Any comfortable, Joe? This is the catheter we put in to advance the laser fiber through. We have the catheter in, and it's right where it needs to be. I'm going to put some fluid around that vein to establish anesthesia so he won't feel very much. Pump that in with a special pump. Put the laser fiber in place here.
Joe, I know you've got your eyes shut, but we do have to give you these goggles to put on while the laser's on.
Yeah, that's great. Check, it's in a perfect position. I'm ready to go here.
Okay.
Switch your glasses out.
Okay, you ready? Laser's on. You shouldn't feel much of anything. Generally, this is pretty painless.
Mm-hmm.
And now all we have to do is wait while the machine slowly pulls the laser down, sealing that vein off. And what that'll do is, this replaces the stripping process, which is a surgical process to remove this vein. So, it'll cut off the blood supply to the varicose veins that he has, and it'll cure the high pressure that's in that vein that's causing the varicose vein, and causing him to have achy legs, night leg cramps, hot legs, and itchy skin in the leg. And they get bad enough, they can even cause ulcers that won't heal in the lower leg. We're fixing his at a good time because he'll never have that problem. We've done about 1,000 of these or more in the office here under just local anesthetic. When we do it like this, we don't need an anesthesiologist here. We don't need expensive operating room in the hospital, and keeps the cost down to a very manageable amount. Plus, he can drive himself here, he can drive himself home. We go have lunch, go shopping. Everything's
Sees
going
us
great.
talking.
We're making lunch plans for you.
You're watching our mouth.
Yeah.
You're about halfway
This is
done.
it, man. That's all there
This
is
is
to it.
life, guys. This is it.
Okay, and this is what his leg looks like afterward.
It's incredible.
Got a tiny puncture wound.
Mm-hmm.
We're just going to put a Band-Aid on that. Put him in stockings, and that will address the main problem with his leg.
Dr. Russell and Amy were great. They made me feel very comfortable. They were very friendly, very nice, and accommodating to my needs of the surgery. Yeah, I've had varicose veins for probably 5 years, and it just kept getting worse. It was time to get them fixed. Yeah, so I came in to the Vein Institute maybe 2 weeks ago. They did an ultrasound, took 10, 20 minutes, and I came back 2 weeks later, and I got my varicose vein fixed. And I mean, it was quick. It took 20 or 30 minutes. I was able to walk afterwards. There was a little bit of pain, if you pushed on it, but it was pretty simple. After the surgery, I was able to walk. I drove myself home, and I went to work the next day. I work a landscaping job, so I'm usually on my feet, and it turned out fine.
Great, that's great.
All right, so it's only been a week since my surgery, but the tired feet and my feelings and my legs have gone away. I mean, there's bruising. It's light bruising, but I mean, the pain is gone. Feels good. I would definitely recommend the Varicose Vein Centers of Greater Cincinnati if you have any type of varicose vein or vein problem.